Hey everyone, before today's show starts, I want to tell you about one of my new favorite items in the refrigerated produce department. You must try Green Giant Fresh's new veggie bowls. What I love about the Green Giant Fresh veggie bowls is that they are a complete meal, packed with satisfyingly crunchy toppings and a fork for on-the-go convenience. With exciting flavors like the Korean barbecue and harvest, and classic flavors like burrito, Santa Fe, Buddha, and fried rice, you will never get bored with the Green Giant Fresh veggie bowls. I eat them for lunch almost every day. I love the affordable price and convenience. Find Green Giant Fresh veggie bowls in the refrigerated produce department at a grocer near you. Welcome to the Produce Moms Podcast, where we believe there is a produce mom in all of us. I'm Lori Taylor, founder and CEO of the Produce Moms. For 10 years, I sold fresh produce to over 300 grocery stores in the U.S. And today, my team and I are fully focused on inspiring people to eat more fruits and vegetables. This show is just one of the ways that we hope to inspire you and your family to eat more produce and live a better life. If you like what you're hearing on the podcast, join our community of almost 40,000 in all 50 states and over 30 countries by visiting theproducemoms.com/subscribe. And be sure to subscribe and leave us a review on iTunes. Thanks for being here. Enjoy today's show. Welcome back, everyone. Today on the Produce Moms Podcast, we are welcoming Dr. Amanda Velasquez as our guest and the star of today's show. Amanda is a bilingual obesity medicine and nutrition specialist. She is board certified as an internal medicine doctor. She assists her patients with weight loss to help them improve their health, wellness, and other medical conditions that may be affected by weight, such as high blood pressure and type 2 diabetes. This is going to be a very informative episode of the Produce Moms Podcast, and super fun fact for all of our listeners, Amanda is actually the sister of one of our previous guests. Allison Velasquez, the founder of Skinny Souping, is the sister of Dr. Amanda Velasquez, our guest today. So Amanda, welcome to the Produce Moms Podcast. We're really glad you're here.
Thanks for having me, Lori.
Yeah, of course. So you must tell us more about your education and your current passion as an obesity medicine doctor.
Definitely. It's been a journey, as any doctor could tell you. So I started off doing med school in Southern Illinois. And when I finished there, I kind of moseyed over to Indiana and did my training in internal medicine. I really had a connection with patients and enjoyed getting to know them and establishing a longer relationship with them to take care of them through the years. So I realized that primary care and outpatient was really my interest. And as I was going into my following years, be it after you finish training in residency, you can enter practice or you can go on to fellowship. And I found that I didn't feel fully equipped to take care of patients suffering from obesity. And that is such a medical concern these days, considering the epidemic. So I decided that I needed more training in that area to truly be able to care for this population. And I established mentors in the Midwest who got me connected with fellowship opportunity out in the East Coast. So I headed out east, went to Boston University and did a fellowship training there in obesity medicine and nutrition, which was wonderful. And I was then in the spot to be able to look for starting my career. And since I'm Latina, really enjoy connecting with the Latino population out here in Los Angeles, this seemed like the great spot to go, being a foodie as well, and knowing that we'd have lots of great access to fresh fruits and vegetables and being able to be around all those who enjoy, going out to restaurants really made me want to come out west. So here I am practicing and taking care of patients in the bariatric clinic, where we take care of patients before and after bariatric surgery. Also, we take care of just patients who are dealing with weight as a chronic disease, maybe don't qualify for bariatric surgery or are not interested in that and need help losing weight. And we work with them on their diet, exercise, lifestyle, and of course, if they need weight loss medications. So that's what I do part-time. And then I also work in primary care to see routine patients, which I really enjoy.
That's great. And so you're actively practicing in the Los Angeles area, and you are very passionate. I know this from our pre-show correspondence. And also, since you studied nutrition in your background, we have to talk about your passion for food as medicine. You are a medical doctor that really believes in prescribing food as medicine, Amanda. So please help our listeners understand why that concept of food as medicine is so important.
Sure. I think that's a great point. We're trying to make that more mainstream, I think, in medicine these days, where we include nutrition in our discussions, but it's still not where it needs to be. Nutrition is such a key component to our treatment plans for patients, and honestly is like a form of a medicine when it comes to taking care of various conditions, from arthritis to diabetes to extra body weight, and the list goes on. So the problem has been that we haven't really gotten well equipped with nutrition education in our medical training. I had an undergrad degree at University of North Carolina that I did a degree in nutrition in the School of Public Health. So that gave me a background when I went into medicine, thinking, I will definitely be gaining more as I get into my medical career. But surprisingly, we're not there. And that's what's causing part of the issue in America, at least, is that we are not sufficiently trained as providers to give the information that our patients need to make healthy choices in their lifestyle and do the things that would help their chronic diseases. So when I'm talking with patients having this background from undergrad into fellowship training, I really try to incorporate nutrition as part of my treatment plan and make it equivalent in its power to really improve their condition as I would a medication. And I give it that value when we're talking about it in conversation, to have the patient's expectations be that we're planning to start perhaps medication A. Also, we're going to be starting a nutrition plan, and we make it something that's going to be customizable and very, unique to the patient according to their schedule and needs. Not every patient can follow the same diet. So I include a diet plan that's going to be simple and that's going to work for them, that we work on together and make sure that it's going to be enjoyable and a lifestyle change rather than a crash diet. We always want to, of course, make it evidence-based. We have a good amount of research out there explaining what can work for different illnesses. And so a lot of times we're getting patients coming in hearing all these different types of media that are giving, diets in the magazine saying that this is going to help you get rid of your acne. This is going to help make you slim. And it's really hard to decipher all that. So being in primary care and then also a weight specialist, I really try to filter that information to explain to patients what's going to work for them effectively and what's going to help long term. So I include that in the plan when we're doing our treatment discussion at the end of our clinic appointment. And I also include exercise in that and have them tell me what their goal is for themselves, no matter how small or big it is, and hold them accountable to that, so that the next time we visit, I'm going to ask them again, how did that go with doing 10 minutes of walking 3 times a week and talking to your girlfriend on the phone while you did it? And that way they feel like they have someone checking in on them, and they recognize that even just the smallest amounts of movement count.
Yeah, I love that. And, another thought that really just stood out for me as you were sharing that incredible insight and passion is, this is such a personalized journey for everyone.
Yes, it really is. I think that that's where a lot of shortcomings come into play when it comes to talking about nutrition and exercise plans. We all have such different schedules, we have different needs, and also limitations with our abilities, with how long it's been since I, last ran, a couple miles. Maybe I'm not at that point. So it's not realistic for us as providers to be giving these kind of generic blank statement guidance to patients. For example, you'll hear the cliche, just go eat better and start exercising. That's honestly worthless, to be blunt. because I think every patient knows that that is helpful. But how do I do that? What does that mean? And what does that mean for me that's going to work for me on a day-to-day basis with picking up kids, grocery shopping once a week, working on a budget, et cetera, et cetera.
Yeah. And also, I mean, it also, throw caution really to all of our listeners about about how they digest the media coverage of all of these different diet, nutrition, weight loss programs that are heavily publicized. I mean, it really is something that is, you really do need the support from your doctor and a trained professional.
Definitely. And I think that's where the internet and social media has been a, blessing, but also has its cautions, like you said, that we get exposure to what others are doing in terms of their health. And we think that maybe that's what's going to work for me. I see, individual A who's lost 50 pounds doing this liquid diet. Maybe that's what I need to do. But it's hard to apply that to each person when, like you said, we're all unique and we all have different needs. So I agree with you that if you're thinking about, be it a big nutrition change to your diet, or if you're wanting to lose weight because you feel that you need to for your health, definitely discuss it with your provider first.
Yeah, I agree. So as we talk about, different things that are threats, to society as it relates to nutrition and this concept, I mean, what would you say is the primary threat from obesity? Like what we are very familiar with the jargon obesity crisis, but what exactly does that even mean? What is the threat of obesity on our society?
I think that's a great question because unfortunately weight is still considered a very taboo topic. And also when patients are suffering from extra body weight, they're not necessarily getting that topic addressed with providers because they're not feeling prepared to do so. And so with asking, where we're at with this obesity environment, the issue at hand is, when patient suffers with extra body weight, it actually is going to be putting them with a shorter lifespan compared to their counterparts. So extra body weight will disrupt the hormones in the body in a way that is hard to go back to where you were at prior to suffering with the disease. So when a person has gained 20, 30 pounds and they start to develop a little bit of changes in their blood sugar, but they don't have diabetes yet, which is called pre-diabetes, and they're also having just a little bit of borderline high blood pressure, and everything is starting to move in a direction where organ systems are getting affected by the extra weight. And it's problematic because it's very hard to get the signals to go back to normal signaling after that. That's where, you'll find that many people maybe listening to the show or friends or family that who've tried so hard to lose weight, 5, 10 pounds, and conceptually it sounds like it should be a breeze. However, it's very challenging when you're having a hormonal disruption and your body is fighting you to stay at the highest weight you've ever achieved. So in summary, the complications of weight is why weight is such a dangerous situation for patients to be dealing with. And we don't look at it, also I like to clarify, as a way of appearance. I think sometimes patients or individuals who suffer with extra body weight worry that we're trying to aim for a perfect image of an individual. And as physicians or providers, we're not looking at what a patient is going to appear like. We're not aiming for a certain body image. This is about making one healthy, and health can be achieved or improved with those who suffer with obesity by losing 5 to 10% of their total body weight. So for example, if you're 300 pounds, that would mean 5 to 10% would be 15 to 30 pounds. You don't need to lose 100 pounds necessarily to improve your health. So we're not looking to strive for this perfect body image. We're looking to help you improve your health.
Right. Amen to that. And thank you for going on record with that. It's important for everyone to hear that. Let's talk about something that, is, in my opinion, it weighs a little bit heavier on the hearts of moms everywhere, and people who love children. I mean, let's talk about the childhood obesity epidemic in the United States. I mean, how concerned are you as a medical provider in this country about the childhood obesity trends?
I'm very concerned, in short. Unfortunately, our tools at this time are pretty limited for what we can do as adjunctive therapy for patients, children who are suffering with obesity. So these children who are suffering with obesity, it's very multifactorial, similar to how adults with obesity, it's a lot of factors playing into this. So children with obesity, oftentimes are perceived by others through judgment of the family that they're contributing to the child's disease. I think that is a very delicate issue because all of us are trying to do our best as parents, and it doesn't necessarily mean that we're trying to, feed a child to make them sick. We feed a child to nourish them. But with the environment that we're in right now in the US, where the food surrounding us is not the healthiest, it's harder to come by fresh fruits and vegetables and, lean produce that's not been processed or sent from afar. So it's very challenging for families to be able to, on a budget, stick to that type of routine without good access, knowledge, and the capability to do so. So with childhood obesity, I think that really policy change is going to be one of the biggest driving factors that could help us to make a difference in this area, and increase in education for those mothers during their prenatal state to really understand what's going to happen when baby comes out of the womb, to help them to be able to fight against this disease. Because we have adults who are suffering with obesity, who are pregnant. When they deliver baby's more at risk for already developing extra body weight the second they come out of the womb. So how can one judge a child who's coming out of the womb with no control of developing obesity just by genetics? And there shouldn't be. And so I think people really need to be cautionary with their judgment of families, be it children or adults with obesity, because there's a lot of factors playing into this. And for children, we need more policy change to really make a change in the needle and moving that.
Right. And when, this from our pre-show conversations, Amanda, I mean, I'm pretty active in, with certain policies in the United States. I'm active I'm an active lobbyist for USDA school meals and making sure that we bring more fresh produce to the center of USDA school meals. I'm also starting to get more involved with the WIC program, hoping that we can extend the age benefit of WIC to go up to 6 years old, so that it's just a seamless transition from WIC to USDA school meals for children that are reliant on, federal assistance in these federal feeding programs for their access to fresh foods. So my question for you, if you're, comfortable saying so on the show, I'd love to know what kind of policy change you would be passionate about seeing.
I think one would be that our nutrition guidelines are non-biased. We have so much lobbyists that are playing into this, and bigger organizations and companies that have a lot of influence over what our dietary food plate looks like. And we need to be able to be free of that to give evidence-based guidance. I really like the nutrition plate that if you ever have a chance, any of the listeners out there want to take a look at, Harvard's website has a Harvard nutrition plate that is free of bias and actually shows you what our US nutrition healthy balance plate looks like compared to theirs and why the differences exist, which is really interesting, I think, to understand that not everything that is out there is necessarily in our best interest, which is depressing, to be honest.
Yeah, no, it is. So how is fresh produce the solution? I mean, I know I'm passionate about it being the solution, but you're the doctor here on the show today. How is fresh produce the solution?
It is the solution because it's one of the healthiest ways that we can get nutrients, from micronutrients to macronutrients, in our diet in a natural way. And that's what our body's going to be able to absorb and really get all the bioavailability, meaning all of the nutrients out of that food into our body and nourish it well. The fruits and vegetable access, I think, would be another policy change, in that I think you're doing great work in trying to get that more established with the connections with farmers and with schools to be able to have that available for children. I think that's one of our biggest limitations, is that if a child is dependent on the food in their school and what's on their tray is chocolate milk and, some type of beef product with some type of frozen other product of a vegetable that's not reminiscent of a vegetable, that's not palatable, and that's not going to make the child be able to grow and nourish and be able to have a healthy life.
Mm-hmm. No, it's great. And, so let's kind of shift back to talking about, the moms that are listening today, or, women that are middle-aged dealing with, really that first time in their life, they're dealing with hormonal changes and realizing like, wow, I look at a French fry and I feel like I gain weight, and so it's, it's definitely, I'm 38 years old. I recently met with my doctor because I want to lose some weight, and, with her guidance, I've lost 10 pounds. And it was, to your point earlier, it's hard. It's really hard. So what is the one thing that you would like all of the moms listening today? What's the one thing you would like them to know that they can do to support their weight loss goals?
That's a great question. And first off, I want to tell you congrats on the weight loss. That's really impressive.
Yeah, thanks.
That's awesome. That's really good.
Thank you.
Well, I think one thing to do would be knowing yourself and knowing what your capabilities are. I always counsel patients when they're trying to lose weight that I think it's often on people's minds if they're dealing with extra body weight, and the issue is that there are things you'll be able to do and change, and there's things that you won't be able to. The same way when we're trying to pursue an extra degree, or we're trying to get our driver's license, whatever it may be, we all have capabilities and limitations. And for those out there who are trying to lose weight, recognizing that there are some things you'll be able to do in your current schedule, and considering the people who are depending on you and your work. And then there'll be some things that you cannot do, and that's okay. And recognizing that that's okay, not beating up on yourself. Because I think what I often see is patients will say, well, I just can't get myself to the gym. I want to get to the gym, but I wake up at 6, I get the kids ready, I make their lunches, I take them to school, then I go to work, then I go to work for 8 hours, and I pick up the kids and I take them to all their sports. Then I get home, I try to get everyone either, showered, dinner. Then I finally get to look at my work on my computer. I eat something in front of the computer, and then the next thing I know, I'm showering and going to bed. So when would I go to the gym? But the thing is that no one said that you have to go to the gym. So it's recognizing what you can do within your ability with your current situation. So I'll say, what can you fit in? And really sometimes it's absolutely nothing. Maybe they'll say, I can't right now. I feel like I can't. Then you're not ready right now. And that's okay. Then we come back to it at another time and you revisit, is it time for me to work on weight loss? And if it is, then the question is, who's going to help you and be your support? Because you're going to need a support system through it, because this is a chronic disease. This is not a matter of willpower. So if this is a chronic disease that you're fighting, you need that support from your provider, just like you did, Lori, to reach out with your physician, and also working with maybe a dietitian if you have access to that at your hospital or clinic institution, and also considering, working with a network of friends or family who are trying to do the same, because it is a roller coaster when you're trying to lose this weight and keep it off. But knowing that a team is supporting you can often make that journey much more pleasant.
Yes. Amen to that. And it's so true. So let's talk. I'd like one more of your tips, if you don't
Of
mind.
course.
What do you want moms to know if they notice that their child is becoming overweight?
Yeah, I had that conversation actually today with one of my patients, and it's such a hard conversation to have. I mean, I don't have children, but I can admittedly say that I have two cats, and one cat is very lean, and one suffers with extra body weight, which is actually it's an epidemic right now with animals, with housed animals, that they're also suffering from obesity. So trying to get my cat to have less food, restricting the food for her compared to the other cat, is actually very challenging and disheartening and sad. And so because food is love. And so that's where I think people don't understand how, those who aren't trying to lose weight, I should say, how hard it is to teach that to a child when the others are getting food and you're having to restrict their portions, or they're having to have, not have the extra ice cream after dinner. So what I would say is, first off, bring up the topic with your physician. The more that patients feel empowered to bring up the topic of weight for themselves and or their child, the more we're going to make this culture shift in recognizing that weight is a disease and that providers need to get the skill set to take care of it. So I really encourage you out there, if you're listening, to do so and talk to your physician. If your physician doesn't have the knowledge or skills to provide you with guidance, then go to the next. You need to find someone who's going to be in your corner and help you to make the decisions that you need for helping your child to lose weight. And also know that some children are suffering with such a severe degree of weight that they're already at adult weight sizes at ages 10, 11, 12. And we need to be able to help those children and with a much more robust program. Those are the children who are not going to benefit from just one or two tips from your provider. You're going to need them to be having seen in a multidisciplinary clinic where they can be having the support of a weight specialist doctor for children, a dietitian, a physical activity exercise specialist. All of those are going to be playing into role. And sometimes even some of these kids will need medication to support them to be able to lose some of this weight. Because as I said, weight's a disease and we treat it just as we do for any other chronic condition. From diabetes, high blood pressure, you use lifestyle changes, medicines, and sometimes even surgery.
Yep. And one other thing too that we've learned through the work that the Produce Moms does with schools and the USDA Team Nutrition Program is the critical importance. I mean, and this is part of the dietary guidelines for Americans, the critical importance of role modeling as it relates to health and wellness in your own home. I think that right there is a great place to start. What kind of example are you setting for your own children? And I definitely like everything that you just said, Amanda, spot on. And I just want to draw emphasis to that because that was that was part of the, one of the critical takeaways that the Produce Moms has had with the work that we've done as it relates to in-school wellness programming and community wellness programming is really that emphasis of role modeling in your home, in your community, in your school, wherever you are connecting with children. And there's also a responsibility if you know that you're going to be entertaining children. I always like to encourage our followers at the Produce Moms, anytime food is served, fruits and vegetables need to be part of that, and keep that in mind, as keep that top of mind when you are entertaining children.
Yeah, I love that. I think the sooner the introduction, the better, the more willingness they have then to try different types of fruits and vegetables and be more of an, open-minded eater, which makes that process much easier down the line than having to try to force feed some of these things that we know are nutritious for them and can taste good. So I agree with you on that. And I think that for moms out there who are trying to help their children to have more fruits and vegetables, the role modeling factor is key. And sometimes it's harder. I think that, again, that knowing, again, your capabilities, I think sometimes we strive for this perfect image that we see from social media or whatever that you got that image from. For example, oftentimes patients will say, well, I didn't have any vegetables because I didn't have time to go to the grocery store, or I didn't have time, whatever it may be. But, it doesn't, I always say there's, no absolutes, and we can definitely do frozen vegetables, that are picked at their prime and can be able to be just as good. And we can try to do that if we're in a pinch. I mean, ideally, yes, of course, fresh produce, that's the goal. That is the goal. The same way not having any soda is the goal. We want you to drink water, but there's a spectrum to getting there. And if getting you there means that we start simple with doing something frozen because it's easier for you right now, then eventually we'll get you there to the ideal state of fresh produce.
Right. Yeah, no, I love that. I love that. So this has just been such a wonderful episode. I'm so thrilled that you came on. You're the second medical doctor that we've had on the show. So it's really great to bring your voice in, and you're the very first that is an obesity medicine doctor. So thank you so much for your very important perspective here. It's an incredibly relevant topic. I know that I'm not alone when I say I really have enjoyed this episode. So Amanda, please, we always have the tradition, this because you've listened to some of the episodes. Our guests get the final word, but I definitely want to make sure that everyone who's listening today knows how to connect with you on social media, where they can go to kind of follow along with your work and your passion. And please, any final remarks that you might have. But thank you so much for being our guest today.
Yes, thank you so much for having me. It's really been a pleasure, and I've enjoyed getting to talk about this. I think it's such an important topic, and I was happy that you were, interested and that we had these joint interests, Lori. So thank you again. And to the listeners out there, thank you for taking the time to listen to this podcast. And if you want to find me on social media, I am at Dr. Mamacita. I got the nickname. I feel like I'm compelled to explain that, but because of the Latina background, and I have always been known as like a mama, although I have only cat babies, but trying to make healthy meals for my colleagues and starting a nutrition club in med school. That's kind of where I got that name. So that is how you can find me on Instagram and also on Twitter. So I appreciate you guys talking with me today, and all the best.
Thanks for joining us on this episode of the Produce Moms Podcast. If you or someone you know would like to be a featured guest, just send an email to lori@theproducemoms.com. We know there is a produce mom in you because there's a produce mom in all of us. Join our community on Facebook and all social platforms. Help us change the way America eats. Thanks again for listening, and we'll see you next time.